We want to welcome and support the motion, as others have done, and start by stating the obvious, that we have a crisis in the health system in all sectors, in accident and emergency, care of the elderly and other vulnerable sections of society, in mental health and right across the health service. And I believe there are two basic reasons for that crisis. The first one is ideological. It's the ideology of the current and past governments that deliberately have set up and gone about creating a two-tier health service, systematically encouraging the privatisation of vital health care. We have poor public health care and poor public hospitals in order to ensure that we have a blooming private health care sector that can maximise profits. We shower them with tax breaks and incentives and increasingly use the private sector to deal with public patients. We've invested a great deal of effort and money in ensuring that private health care is the cover that most ordinary people desire as a necessity, because they see the public health care in such a crisis. The queues across all our key services, the waits for treatments, for scans, for MRIs, for therapy, for speech and language services for children, you can go on and on. The health care, the home care hours, help for the elderly in the home, the trolley crisis are not a series of unfortunate events, but they are the predictable result of a policy of privatisation designed to force people into the private sector. The second reason for the crisis is the one addressed in this motion, and that is the attempt by this and previous governments to blame the recession on public sector workers and to use that recession as an excuse to put the boot into them all, and particularly into nurses, midwives and other healthcare workers. You cannot have a decent healthcare service if you put the workers who provide that service into intolerable situations of cuts, closures, closed wards and worsened conditions that they have to work in. We also demand of nurses that they work an extra shift every month for free in crowded and understaffed hospital and emergency wards. We worsen their pay, their conditions and create a two-tier pay structure that discriminates against newly qualified staff for doing exactly the same work. The recent Public Services Stability Agreement did not address these issues at all, Minister. Pay restoration is still not a reality, and workers are earning less than they were before the recession. So there is no real solution for workers when rents are rising and house costs are rising and they are being forced out of the country, as has been clearly illustrated by the letter written to us all by the Psychiatric Nurses Association today. But it seems to be difficult for any government to acknowledge that the contribution to the health crisis arising from the inequality in pay and the brutal conditions that nurses and midwives are forced to work in actually contributes to the crisis. It's extraordinary that we can find it so difficult to acknowledge that the pay of nurses and midwives needs to be increased when we can increase our own pay and the pay of bankers overnight. And thanks be to God there's more of them than there is of us, but the inequality and the visuals of that inequality are starkly obvious. So I want to say to every party and to every deputy in this House that those of us who have supported the FEMPI legislation, who have nodded and winked when it has been renewed every year, bear a responsibility for the continuation of that legislation and its contribution to the crisis in our health service, because it abuses nurses and midwives. So FEMPI has to end, it has to go. It was an extraordinary blunt instrument that has outlived its life, and with that has to be heralded in pay equality and a complete change in the way we treat our health service workers. And that goes right across the board, Minister. We lost the whole CAMS unit, as you well know, in Cherry Orchard Hospital for 6 months of last year because of a failure to retain psychiatric nurses. That's going to happen again and again and again, and this crisis is in some ways only beginning because of the reality of the shortage of nurses. If we begin by paying them properly, by recognising the respect they deserve, we might begin to address the crisis.